It's a clever way to shed light on the seriousness of men's health issues. This month, the Movember campaign dares people across the world to grow a mustache and join the movement to help men live longer.
Joining us now, the doctor you just saw in that photo with a Fu Manchu all his own, Dr. Craig Hunter from Urology Specialists of Nevada.
It's a good look.
Good morning, doctor.
Morning. Thank you.
That is a good look.
Very nice.
Yes.
Thank you.
Well, you and your team are actively participating in Movember. Tell us what the movement of Movember is all about.
Well, it's an opportunity for us to highlight men's health, particularly prostate cancer. At Urology Specialists of Nevada, we're interested in all facets of men's health, whether it's testicular cancer, prostate cancer, low testosterone, erectile dysfunction, but particularly prostate cancer.
Absolutely. Let's talk about prostate cancer in particular. First of all, what exactly is it? What is the prostate? Where can we find this? How can we catch it early?
Right.
Hit us with everything.
Good question. Good questions. The prostate actually helps you to be fertile. It's part of men's reproductive system. It's just beneath the bladder. So when you urinate, particularly when you urinate, if you're a male.
Yeah, of course.
No,
When you urinate,
Well,
you urinate through this prostate, and as men get older, the prostate gets larger. It can sometimes cause urinary trouble, and sometimes can cause prostate cancer, particularly as we get older.
yeah.
Interesting. Yeah.
Most common cancer in men, solid cancer in men.
goodness.
Wow.
Most common solid cancer in men. So it's important to catch it early. In most cases, you actually don't have symptoms. You don't know.
Really?
And I'm assuming the symptoms that do show up are so low key that you wouldn't even know that there were
You may
symptoms.
not even know. And by that time you have symptoms, sometimes it's too late. We're limited on how we can treat it if we don't catch it.
What should we keep an eye on?
Let's talk about some of those symptoms.
Yeah.
Well, sometimes you'll have urinary symptoms, but in most cases we screen for it with a blood test once a year. Men over the age of 50.
Okay.
We recommend getting a yearly digital rectal exam, a yearly prostate PSA or prostate specific test. And if that blood test gets elevated, we start to be concerned whether or not there's cancer in the prostate.
I know that the men love the digital rectal exam. It's
It's our
fun.
favorite part too.
Yeah, I'm sure it is. Yeah, it's a blast for you. So let's say you catch something that's a little meh. There's treatment options. Let's talk about some of those treatment
Good question. If it's caught early, if it's localized, what we call localized or contained within the prostate only, there's a surgical option. We use in most cases we use a Da Vinci surgical robotic system to aid in prostate removal or radical prostatectomy. If you're not interested in surgery, there's an option for radiation. We use a Calypso method and target with the idea of minimizing side effects from radiation. In some cases, we watch it, and it's particularly low-grade cancers we can watch. We don't need to treat
right away.
We don't need to treat right away, and we can sometimes minimize the side effects of surgery or radiation by watching it.
Dr. Hunter, are there certain groups of men who are more vulnerable? Is there a certain age group, a certain ethnicity?
Good question. Yes, and in fact, particularly African American men, prostate cancer can affect African American men more commonly than other ethnicities. In fact, not only do they have a higher risk of prostate cancer, they have a higher risk of dying of prostate cancer.
Wow.
But generally, if you're older, if you're in your 30s, it's not necessarily a concern. 40s, less concerning unless you have a family history of prostate cancer. So it's generally older men and African American men.
I got to ask, at Urology Specialists in Nevada, is everyone going for this Movember? Everyone's all in?
Well, everyone's all in emotionally.
Gotcha. Not everybody can grow the mustache as good as you.
Well, I don't know that this is very good, but it does the job.
Pretty decent.
It does the job.
Grandma Tempesta grew a better mustache than I did.
Well,
it's the truth.
Talk about
She's
your
pure
grandma.
Italian. I can't do it. It's impossible.
That's terrible.
You're having some fun with this over
yeah, we're having a good time. Dr. Wilson, Dr.
even the ladies are getting on.
Oh yeah, the girls. Why not?
Yeah,
Nice.
we have a lot of even the office, our office staff. They're all been very good. Dr. Zomick, Dr. Wilson, and Dr. Ludlow are growing they are growing it actively.
Yeah.
Other providers, Dr. Weiss already has a good, handsome set of facial hair. So other people can do it naturally and pull it off.
I think you're doing a really good job. When will you shave, might I ask?
At 11:59 on November
Okay.
30th.
30th.
Oh,
Okay.
that's cheating. You have to do it December
Okay,
1st at
12:01
Enjoy it
on
now,
December
ladies.
1.
It's going away.
It's out.
It's great having you, my friend. Thank you so much.
Thanks for having me.
Urology specialist of Nevada, 3 convenient office locations across the valley. You can find one near you by contacting them at the address or website or phone number you see right there on your screen. Proud sponsor of the Morning Blend. They're also on Facebook and Twitter as well.